A growing population in the U.S. is Asian Americans, one of the fastest growing populations. In particular in Dallas, we have over 100,000 South Asians. And we know that South Asians in particular, people from India, Pakistan, Bangladesh, Sri Lanka, and Nepal, tend to suffer much higher rates of heart disease. One of the questions that we wanted to answer was whether a family history was a strong risk factor for heart disease in South Asians. We know it is a risk factor in other groups. We looked at a marker of risk for heart disease called coronary artery calcium. That's a simple test that you can get in most major cities. It looks for calcification in the arteries around the heart. And we know that's a strong marker for plaque buildup in the arteries around the heart. And we know that you need plaque to end up having heart attacks and strokes. So what we found was that South Asians who have a family history of heart disease, meaning they had a relative who had a heart attack, were at 3 times the risk for having a really high burden of coronary artery calcium. This was the first study to look at that in a systematic way in this population in the United States. Despite being a younger age in general in this population, the degree of coronary artery calcium is about on par with older white population. If you have family history of heart disease, you're South Asian, I think this is an extra motivator to say, maybe I should get my heart disease risk checked out and talk to my primary care provider or cardiologist about what I can do to lower that risk, especially if I have a family history.